Welcome to Rwanda Medical Academy. Today, we'll share together 8 common risk factors of stroke. Starting with statistics, each year, nearly 800,000 people in the United States alone experience a stroke. That's someone every 40 seconds. Imagine that. A matter of seconds can drastically alter the course of a life, impacting health, livelihood, and quality of life. The global numbers are even more startling, but knowledge is power, and understanding what increases the risk of stroke can be a lifesaver. But what exactly puts you at risk for this life-altering health event? Let's find out. Let's start with the expert interview done with Dr. Jane Smith, a renowned cardiovascular specialist who explains how hypertension and hyperlipidemia contribute to stroke risk. Factor No. 1, hypertension, or high blood pressure, is a significant risk factor for stroke. When blood pressure remains high over a consistent period, it can cause damage to the blood vessels. This increases the chances of a blockage or rupture that can result in a stroke. Factor No. 2. Similarly, hyperlipidemia, or elevated levels of cholesterol and fats in the blood, can contribute to the buildup of plaque in the arteries. This condition is known as atherosclerosis. If a plaque ruptures or causes a blockage, it can lead to a stroke. Specifically, high levels of low-density lipoprotein cholesterol are a major concern as they contribute significantly to atherosclerosis. As Dr. Smith explains, managing blood pressure and cholesterol levels is crucial in preventing strokes. This can be achieved through a combination of lifestyle changes, medication, and regular medical checkups. Next factors are: No. 3 is the age, No. 4 is atrial fibrillation, and No. 5 is diabetes. Geriatrician Dr. John Lee delves into why advancing age, atrial fibrillation, and diabetes increase stroke risk. As we age, our blood vessels may lose some of their flexibility, becoming more susceptible to damage. This damage can lead to blockages or ruptures, increasing the risk of a stroke. Atrial fibrillation, a type of irregular heartbeat, can cause blood clots to form in the heart. If these clots travel to the brain, they can block a blood vessel and cause an ischemic stroke. Lastly, Dr. Lee discusses diabetes. Elevated blood sugar levels can damage blood vessels and contribute to atherosclerosis, a condition that can increase the likelihood of a stroke. It's crucial, he says, to regularly monitor and manage these conditions to prevent their harmful effects. As we've heard from Dr. Lee, regular health checkups and effective management of these conditions can significantly reduce stroke risk. Lastly, the following factors are: No. 6, drugs; No. 7, smoking; and No. 8 is sex, being male. Dr. Lisa Green, a pharmacologist, talks about the stroke risks associated with certain drugs, smoking, and being male. She highlights that certain drugs, notably cocaine, can lead to an abrupt increase in blood pressure or cause blood vessels to narrow. This can result in blockages or ruptures, significantly increasing the risk of stroke. Smoking, she explains, damages blood vessels and promotes the formation of blood clots. The reduced oxygen levels in the blood from smoking further harm blood vessels and elevate stroke risk. Turning to the topic of sex, Dr. Green elucidates that men have a marginally higher stroke risk than women. This is partly attributed to hormonal differences and other factors such as higher rates of smoking and alcohol consumption among men. The key takeaway from Dr. Green is simple: avoid harmful drugs, quit smoking, and regardless of your sex, take stroke risk seriously. So, what can you do to reduce your stroke risk? Well, a lot actually. And it all starts with acknowledging the importance of regular health checkups. These visits are more than just a routine. They offer a chance to identify and manage risk factors like hypertension, hyperlipidemia, and diabetes effectively. By monitoring these conditions, you can help prevent their progression, reducing the likelihood of a stroke. But managing health conditions isn't the only way to lower your stroke risk. Lifestyle changes can have a significant impact as well. Adopt a healthy diet, one that's rich in fruits, vegetables, and whole grains. These foods can help lower blood pressure and cholesterol levels, addressing 2 of the risk factors we've discussed today. Regular physical activity is another key piece of the puzzle. Strive for at least 30 minutes of moderate intensity exercise most days of the week. This can help control your weight, reduce your blood pressure, and improve your overall cardiovascular health. If you smoke, quitting is one of the most effective ways to reduce your stroke risk. And if you don't smoke, don't start. Smoking damages your blood vessels and increases the risk of clots, both of which can lead to a stroke. Remember, your health is in your hands. Regular checkups and healthy lifestyle choices can significantly reduce your stroke risk. Don't wait for the unexpected. Take action today. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.